Hello, I'm Elizabeth, and I am a student nurse at the University of Michigan, and will be presenting a patient to you. Patient is a 49-year-old married Caucasian male. Patient has worked for Bosch Corporation for 22 years as an engineer and has been an engineer for all of his life after receiving his degree from Lawrence Technological University. Patient's usual source of medical care includes annual visits to his primary care doctor, dentist, and ophthalmologist. When taking the patient's vitals, his blood pressure was 118/74, his resting heart rate was 70 beats per minute, and his respiratory rate was 14 breaths per minute. The patient's chief complaint is right knee pain related to a torn PCL. The pain originates on the inside of the knee, below the kneecap. The injury initially occurred when the patient was 22 years old while playing football. Not only until this past year has the patient experienced knee pain as a result of this injury. The pain was described as dull and increases when walking on uneven ground. The pain he experiences was rated a 3 out of 10. His pain gets worse when walking on uneven surfaces and when standing or walking for long periods of time. His pain is alleviated when he rests. For treatment, the patient lets his knee rest. So far, the patient describes the injury to have minimal impacts on his activities of daily living and his emotional well-being. The patient describes his injury as only an inconvenience. The patient's second complaint is a skin lesion on his right upper shoulder that he noticed about 3 months ago. The patient denies any associated symptoms. The lesion does not affect the patient's activity of daily living, but causes body image disturbances. The patient's medical history includes a diagnosis of allergy-induced asthma at age 6. The patient was diagnosed with hypothyroidism at age 11 when the patient's family doctor began screening for hypothyroidism when his sister was diagnosed. When the patient was 22 years old, he tore his posterior cruciate ligament in his right knee while playing football. Surgery was not recommended for his injury by his primary care doctor. When the patient was 25, he endured a grade 3 torn acromioclavicular joint in his right shoulder while playing football. His injury was never treated and has no complaints from the injury. The patient also has left shoulder pain with unknown origin about 5 years ago and received a cortisone shot and an MRI from his orthopedic doctor. Soon after, he participated in 3 weeks of physical therapy, which resolved the pain. The patient also has high cholesterol and triglyceride levels. The patient is fully immunized and has allergies to maple, box elder, and birch trees along with grasses, molds, weeds, and animals. He has no known drug allergies. The patient's only surgery was when he was 13 years old when he fractured his right hand. 2 pins were inserted and removed for the correction of the bones. In terms of medication, the patient takes levothyroxine for his hypothyroidism at 150 micrograms per day by mouth. He also takes Flonase for his allergies between the months of April and November. The dose is 50 micrograms of nasal spray daily in each nostril. In the functional assessment, the patient reports no drug use, smoking or tobacco use, and moderate alcohol consumption at about 1 standard drink per week. Patient reports no exercise and good sleep habits averaging about 7 hours per night. The patient describes his diet as healthy and meeting the required amounts of fruit, vegetables, proteins, and carbohydrates. The patient's caffeine intake is moderate, averaging about 2 cups of coffee per day. Patient reports wearing his seatbelt all the time, and the patient spends a lot of time outside but reports no sunscreen use. In collecting psychosocial data, the patient reported himself to be spiritual and associates with the Catholic faith. He also stated strong relationships with his wife and children, and he also attends health checkups regularly. Patient also reported that his job is a frequent stressor. Patient's family history includes a father with Alzheimer's disease who died from natural causes, and his mother who had basal cell carcinoma and died of congestive heart failure. His sister has hypothyroidism, and his uncle died of bone cancer. In the general review of systems, the patient is generally satisfied with his health, but is currently dieting to lose weight. Patient has lost 5 pounds over the last month. Patient reports no fatigue, fever, chills, night sweats, or hot or cold intolerances. Due to the patient's knee pain, a review of the musculoskeletal system was conducted. The patient reports 3 out of 10 joint pain during activity in his right knee, including crepitus and stiffness in his right knee. Patient reports no swelling, warmth, or redness in joints. Patient reports no muscle pain or cramps. Patient reports no bone pain, deformities, or trauma. Patient has no neuromuscular disorders such as arthritis, lupus, osteoporosis, spinal problems, carpal tunnel syndrome, tennis elbow, or foot deformities. Patient's family history consists of a paternal uncle who died of bone cancer. Patient uses a fitted knee brace for his right knee when he knows that he'll be on his feet for long periods of time. Patient reports that activities of daily living are not hindered from the knee brace. Upon physical examination of the musculoskeletal system, patient's bone structure and muscle mass were symmetric and even. Patient had an erect posture and had an even, steady gait and showed no signs of scoliosis. The patient's shoulder joints had limited range of motion during shoulder flexion in the left and right shoulders. All other joints showed full range of motion. Upon palpation of the joints, patient's right knee had crepitus. All other joints had no erythema, inflammation, warmth, pain, or crepitus. 5 out of 5 muscle strength in all fields. Due to the patient's concern with his skin, the integumentary system was reviewed. The patient had no previous skin history and no change in skin pigmentation. The patient reports no excessive dryness or moisture, no itching, or excessive bruising. The patient reports no known changes in moles. Patient reports no rashes, change in medications, or change in nails. Patient does report hair loss on shins, and patient also noted a lesion on the upper right shoulder. Patient reports no use of sunscreen when outside. Skin family history includes his mother who had basal cell carcinoma. Upon a physical examination of the patient's skin, his scalp had no signs of flaking, lesions, or pest infestations. His hair is balding at the top of his head and has an uneven hair distribution on his shins. All other hair is shiny, thin, and evenly colored. Patient's skin was clean, dry, warm, and no body odor was detected. His skin color was appropriate for his genetic background and evenly pigmented. Upon palpation, patient's skin had no excessive moisture, good skin turgor, and good thickness. The patient had several moles throughout his body, all of which were symmetric, even bordered, even in color, and had no evolution. No birthmarks were noted. A crusty tan papule, 4 millimeters in diameter, was noted on his upper right shoulder. Patient's skin was equal and bilateral in temperature, showed good mobility, and had no signs of edema. His nail beds were pink and clean, with a regular surface and good nail attachment. Patient's capillary refill was less than 2 seconds. In addition to these system exams, I would perform a cardiovascular exam. According to the World Heart Federation, physical inactivity and high cholesterol are risk factors for cardiovascular disease. Because of the patient's sedentary job, no additional exercise at home, and his high cholesterol, he has an increased risk of developing a cardiovascular disease. Therefore, a cardiovascular exam would be necessary. I would also perform a head, eyes, ears, nose, and throat assessment for the patient's risk of developing a goiter. According to the American Thyroid Association, a goiter develops from either the thyroid producing too much hormone, which would be hyperthyroidism, or too little hormone, which would be hypothyroidism. Because of the patient's hypothyroidism, I would perform a head, eyes, ears, nose, and throat assessment to look for signs of a goiter. Thank you for listening.